This integrative session deals with Chapter 3, the assessment phase of the nursing process. And again, this is a review based on our last class period. Make sure you have read the chapter content based on your learning objectives and the main points, and come to class having completed the critical thinking activities and other exercises in volumes 1 and 2, and having answered your learning objectives. The nursing process. Assessment. The process of assessment involves a systematic process in which you gather information related to the patient's physical, mental, spiritual, socioeconomic, and cultural status of an individual, a group, or community. Assessment involves the collection of data. It is systematic, as stated before, and the process is ongoing. It involves categorizing information or data collected and recording the information. Steps that are related to the assessment process involves diagnosis. Data collected is used to identify the client's actual or potential health problems and strengths. The next step is planning outcomes and interventions. The data helps you to formulate realistic goals and to choose interventions that are most likely to be acceptable to the client and be effective for the client. The next step involves implementation. During this step, you gather data by observing the client's responses as you perform interventions. The next step involves evaluation. During this step, you assess the client's responses to interventions, and the client responses are data. How's data used? It's used by other discipline collaboration, such as with a physician, physical therapist, nutritionist. It's just based on the needs of the client and who the collaboration is involving. The data is also used to plan nursing care for the client or patient, to ensure clients receive appropriate or proper care, to ensure the client receive care from qualified individuals, and at the time that it is needed. What's the difference? A medical assessment focuses on the disease and pathology of the disease process as indicated in class. Nursing assessment focuses on the client's responses to the illness. And you gave an illustrative example in class. Think of some others to be shared. Can I delegate assessments? The American Nursing Association Code of Ethics for Nurses, Provision 4 from 2001 states, quote, "The nurse determines the appropriate delegation of tasks consistent with the nurse's obligation to provide optimum patient care," unquote. We identified some activities that could be delegated. I want you to think of others and share those in class. Identify the task and to whom the task can be provided. I will also bring information to be discussed. Resources to guide nurses in delegating can be obtained from the State Nurse Practice Act, agency policies and procedures, accrediting agencies, and the American Nurses Association. Each was discussed in class. If clarification or information is needed further, please ask. Types of assessments, as discussed, include initial, ongoing, comprehensive, focused, and special needs. Special needs assessment examples include nutritional. You may have a client who is malnourished and needs a consultation done by the nutritionist. Consultations as needed for clients are done through the physician. The nurse can identify a need and place it in the chart or on the chart. You need to follow your facility's means by which they have information communicated. But you can identify any special need that exists and have it communicated to the doctors so that further intervention can be done. Functional ability. Is the patient having problems with range of motion, walking, talking, etc.? Pain. If the patient did not have pain when they entered and there has been a change in status, this information needs to be conveyed. You can try non-medicinal approaches to pain, and if it continues to worsen based on your pain assessment and non-medicinal pain management techniques, then further intervention is warranted. Another special need assessment is based on the individual's culture. You need to be familiar with the cultural variations that exist, and you can talk to the individual, and if they cannot communicate with you, you can have a translator available. Most healthcare facilities have translators if an individual is from another country, or they do not speak English, or if their cultural variations exist. You also can get access to resources in the facility to determine what is appropriate for that individual's culture. And you also have subcultures. Spiritual health of the individual needs to be assessed. Psychosocial assessments are done, wellness assessment, family assessment, and community. If you have further questions about this information from the last class period, please make it known Monday. What is a comprehensive assessment? It consists of a complete nursing history and physical examination. It contains subjective and objective data. And as you know, subjective data is information that is revealed by the client or patient or other individuals. Objective data is what you see. Basic physical assessment techniques that you should be familiar with from your previous classes include inspection, which involves looking, smelling, as examples, palpation, touching, percussion, and auscultation. The nursing interview is a purposeful communication. It is structured and it involves questioning the client to obtain subjective data. The purpose is to obtain or gather subjective data for the nursing database. The nursing interview also has directive interviewing steps to obtain factual, easily categorized information. Non-directive interviewing entails allowing the client to control the subject matter. Nurse's role is to clarify and summarize the information revealed by the client. This information is preparing for the interview. You've done and Health assessment. Know the purpose of the interview and how the data will be used. Read the client's chart. Form some goals and opening questions. Schedule uninterrupted time and have your forms and equipment ready. Compose yourself before entering the room. Preparing the space in preparation for an interview. Provide privacy. Remove any distractions. Position yourself at the same level as your client. Sit down. Do not hover over the bed or chair, wherever the patient is positioned. Introduce yourself. Call the client by name. Tell the client what will be done and why. Assess readiness to discuss health issues. Assess and provide for comfort. And assess for anxiety. Conducting the interview involves individualizing your approach. Use active listening. Pay attention to nonverbal communication. Use mostly open-ended questions. Avoid healthcare jargon. Curb your curiosity. And do not give advice or voice approval or disapproval. Validating data collected. You need to validate subjective, objective data that does not agree or make sense. And we talked about an example in the classroom setting. Client statements that differ at different times during the interview process should be validated. Data that's far outside the normal range. Factors are presented that interfere with accurate measurements. Documenting data. You need to document as soon as possible. As indicated, you need to make the patient aware that you need to record information. You can just jot down a few clues and go back later and do detailed documentation. Write legibly without using acronyms. Avoid using inferences. Quote unquote, just the facts should be documented. Use the client's own words and record only pertinent, important, and relevant information. Reflecting on the assessment. Are my data complete, accurate, validated? Ask yourself, did I record data and not conclusions? Did I follow up with special needs assessment if indicated? Think about the client interview process. Review the physical assessment findings, observations, and examination. This ends the integrity presentation. Again, any questions you may have, ask in class for review purposes.